Hi, I'm Bruce Agins, and we're going to turn now to a series of short modules that will focus on how to use your Cascade data and translate it into action to target improvements in your program. This first one is going to focus on interpreting Cascade findings. Strategies for using data include implementation of evidence-based interventions, guideline-based recommendations, or strategies codified in service delivery manuals. Other techniques include the application of the methods of quality improvement, which we will describe in this module. These tools can be used at any level of the health system, and although commonly used within healthcare facilities, they're also effective at city level or even larger jurisdictional levels to engage stakeholders. Practically speaking, they can be applied in small group breakout sessions and in exercises that allow for different observations generated by different groups of stakeholders, which can then be synthesized into a citywide picture of the system and the compiled causes of the gaps identified in the cascades that can then be used to prioritize for targeting of interventions. The specific module objectives are to describe how to use data from HIV care cascades to improve care and address gaps, to provide guidance on how to quantify the magnitude of gaps along the service continuum of HIV care and treatment, and to show how cascades can facilitate the identification of priorities to guide program improvement. Examples of those improvements will be in subsequent modules. Root cause analysis is an important strategy to understand the factors that determine the outcomes that we want to achieve, whether they are improvements in linkage, retention, same-day treatment, or viral load suppression. Root cause analysis is defined as approaches or tools or techniques that are used to uncover the causes of identified problems and gaps. Examples include brainstorming, flowcharting or process mapping, fishbone diagrams, also known as cause and effect diagrams, and using the Pareto analysis. The outcomes that we want to achieve are part of a large, complex system that involve many processes, and these can be affected by many different things. And these different strategies are methods to help us identify these factors, leading again to prioritizing them to target our actions and improvement strategies. Brainstorming is the simplest method, but it's most effective when the participants represent the many different processes involved in the system, and also includes patients who can contribute the reasons why they may not be able to access care or are encountering negative experiences in the care setting. It's also more effective when facilitated so that individuals who represent the care team can all contribute effectively. The next slides will focus on cause and effect diagrams, commonly known as fishbones, as I've mentioned, and process maps and the Pareto analysis. Ideally, with a process map, it should depict the process as it currently exists, not how people think it should be. Healthcare processes are complex, and this should be shown in a flowchart. However, a good way to start is to get people to map the system as they experience it now. So the idea is to get each team member's perspective from their point in the process and to then map it out. As I've mentioned, different providers will have different views of the process, and clients will have a very different view than providers. This picture is an actual process map diagrammed in Rochester, New York. In this map, which is again a real world example, clinical and community providers came together to map out the different pathways that patients may travel to access services that they need across the continuum of care. As quality improvement interventions and changes are adapted and adopted, the process can become streamlined and can be modified to meet the goals defined by providers and people living with HIV. This picture also reminds me of the adage that we use in quality improvement, which is that every system is perfectly designed to achieve exactly the results it achieves. And even though we may not purposefully design a system like this one, it's been designed in practice. And so it's going to achieve results when it comes to linkage and engagement and care that reflect this system. So you might want to think about how effective this system is when it comes to achieving results. As I've mentioned, then the idea is to design an ideal step that you want to achieve. And this example from Ontario gives us guidance on how to design a flowchart. So we've identified the process that we're going to study, the process we want to understand better. We decide on the beginning and the end of the process. We outline each step in the process, place it in sequential order, and then we want to step back and look at it. Do we see repeat steps? Are there steps that aren't well understood? And are there things that we've missed altogether? And so it gives us an opportunity to look at our system and then move forward. So here are some process maps focusing on rapid ART initiation. And this gives us the sequence of actions that comprise the process to both explain and visualize all of its steps. Mapping the process shows its complexity and can lead to the generation of ideas for improvement, as I previously mentioned. The example on the left is from San Francisco and shows us different entry points where people can learn their HIV status. And then from those different entry points, they will come into a setting where they can be counseled, they can be assessed to determine if they can access medications, and then they receive the service to initiate rapid ART. And then it identifies the follow-up steps so that if ART is accepted, how to follow up in a short time frame to monitor for side effects and foster engagement and care. Similarly, this diagram from New York State AIDS Institute shows us the steps in rapid ART. Again, identification, counseling and education, assessment and referral, lab testing, treatment, help with payment, and then the follow-up and adjustment steps. So any of these process steps, whether in New York or San Francisco or any place else, become areas for targeting improvement. The cause and effect diagram, also known as an Ishikawa diagram or a fishbone, as you can see, is very, very commonly used in quality improvement work. Now, as you can see, the box on the far right, or the head of the fish, contains a statement of the problem being addressed. And in this example, it's the low viral load completion rate. So this is a common tool to group causes that are determinants of the outcome of focus, and it can combine brainstorming and analysis techniques to identify the key reasons why something is happening. The tool will guide the team to identify the primary cause, reason, or gap, which will need to be addressed. There are common strategies for grouping causes, for example, people, policies, equipment, and processes. And these can be categorized with more specificity depending on the area being improved. And in this example from South Africa, you can see the viral load testing factors grouped into those associated with patients, clinical delivery systems, the staff factors, the lab, and data quality. A spine leads from the head of the fish down the center of the diagram, and from the spine are the categories. Here's a simpler example for focusing on viral load suppression that depicts major categories for further analysis. So again, it gives us a systematic way of understanding causes and can identify different causes that we want to focus on. So here they include fear of initiating treatment, side effects of treatment, treatment failure, and also mental health diagnoses, substance use issues, and whether patients are lost to follow-up. All of these, of course, can contribute to lack of viral load suppression. And any one of them can then become a target for improvement activities. So the next level is to go beyond identifying the suspected cause of a problem to actually quantifying them. So why is this important? So to answer this, let's look at the Pareto Principle, named after the economist Vilfredo Pareto, who underscored that the majority of consequences are caused by a small proportion of those causes. So that's translated as 80% of the problem is a result of only 20% of the causes. And these are also called the vital few. And if we tackle those, we can more quickly achieve our desired results. So you can see here in this slide, the vital few here on the left, when added up, achieve, represented in this graph, which is green, up to 80% of the causes. So here's where we want to focus our initial activities before we dive into some of the other factors that will have less effect on our overall results. Here's an example from the state of Mississippi's Quality Improvement Learning Network that involved 5 clinics and demonstrates the quantification of root causes to facilitate the application of the Pareto Principle. The table on the left shows in bold the most common causes of incomplete viral load suppression in Mississippi. So there were a total of 100, and you can see people on ineffective regimens, re-entering care, not taking their medications appropriately, and troubles with viral load monitoring. Here, non-adherence, I misspoke, is one of the most common causes. So these are targeted in the interventions. And you can see here, after they've drilled down their data, they've now then identified interventions that focus on those most common causes. And here are some of the things that they came up with: assisting with payment, having meds delivered, reminder calls, pill planners, providing mental health services, extra adherence education. Focusing on these will have the greatest impact as improvement work is started. So in conclusion, data from Cascade should be used to improve performance. Key steps include quantification of the gaps across the cascade, whether viral load suppression, treatment initiation, using different tools to determine the causes of those gaps, and prioritizing those which are particularly urgent and yield the greatest outcomes. This information should then drive selection and implementation of improvement interventions, as you've seen in the previous slides. And again, we'll be turning to some of those interventions in different areas in the next module. For those of you that would like to spend a little more time learning how to conduct some of these processes of root cause analysis, whether flowcharting, root cause analysis, fishbone diagrams, or other techniques, you may want to turn to this online tutorial at the Quality Academy, which you can see here at the Target HIV Center. So thank you very much for your attention.